Hello and welcome to episode 133 of Tom's Hirschsprung's podcast. I'm very glad to be joined this afternoon by Nicole Voss. Nicole, welcome to the podcast.
Hi, happy to be here.
Thanks so much for coming on. I'm really interested to dig into this story about your youngest son, who has Hirschsprungs. Yeah, lots of the really interesting things that we're going to chat about. And I guess we'll kind of start from the beginning, if you will. Over to you.
Yes, absolutely. Okay, so I have four kiddos. Holt is who we're talking about. That's my 6 month old. He was born December 17th of 2025. I delivered him at 39 weeks, and this was my third C section baby. So they always deliver at 39 weeks with repeat C sections. So nothing alarming. Everything went really, really well throughout the pregnancy. And actually, me being 34, it was my best pregnancy, which is crazy. No crazy blood pressure, no swelling everywhere, just pregnant in the stomach, not my legs, not my ankles, nothing crazy. So really enjoyed being pregnant with him, and we went into it knowing he was our last too. Um, so had him on December 17th. Everything went really, really good. No concerns. Had just a regular, the diapers, making sure he had enough pee diapers, making sure that he did poop, which he did. Um, and then we go over to the 18th, and that's where the story gets a little weird and a little wonky. So they kept him overnight for a little bit so I could get some sleep because I figured they would discharge us the next day, which they usually do. If you're a repeat C-section and you feel good enough, they'll send you home. So we started feeding him, which I had already kind of gave them a little bit of notice ahead of time that our third child was lactose intolerant, which I thought maybe he would follow suit. So I was just like, hey, if he starts spitting up, we probably should just go straight into soy milk. I just because take the lactose out of it if he starts spitting up, which then I kind of started eating my words. So he around, I want to say 9, 10:30 in the morning started puking, which there's a huge difference between kind of just spitting up and vomiting. And at this point, he's vomiting. And I tell the nurse, and I'm like, hey, he is spitting up pretty much everything we're feeding him. So they bring down soy milk from the ward, and they're like, okay, let's try this. So we try that, same thing. He is continually puking. But mind you, I think they say turnaround time with a baby switching formula can take days for the old formula to completely leave the system. So they're telling me not super concerned. Let's just move on about our day. Okay. So 2 o'clock rolls around. He's still puking. They release us from the hospital. They let us go home. And at this point, his stomach is hard, but not to the point where I'm like super concerned, but I'm still like, okay, this is his stomach's hard. This is a little weird. So I call back up to the pediatric unit that we had just left, and I'm like, hey, weird things happening. He's still puking, and his stomach looks like I poured baby oil on it, and it looks like he has abs at the ripe age of 2 days old. Not normal. This is weird. So they go, we marked on his chart that his stomach was distended, and we brought this to the pediatrician, but they just jotted it up as soy irritation because I had told them that my daughter was lactose intolerant. So, not happy to hear that because no one brought that to our attention before we left the hospital. So, red flag number one of very many. So we're going through the night. My mom had just left my house around 2:30 from watching my other kids. 6 o'clock, he's lethargic. He is not wanting to take breast milk. He is not wanting to take soy milk. He is completely does not want to eat at all. Totally disinterested. Still puking, actually waking up to dry heave and go right back to bed. Not normal baby behavior. So he's up long enough. to vomit, scream, fall asleep. So it's like, I want to say 6 o'clock. This is the second time I called the pediatric unit that we had just left. And I go, something is wrong. I don't know what to do. I've had 3 other children. None of them have ever done this. Even with learning about the lactose intolerance with my daughter, there was nothing that was even remotely close to this. So, first thing I'm going to say as a mom, always follow your gut. You're going to know if something's wrong with your baby. It does not matter what a person in the medical field says. You know your baby better than anybody. Specifically, you carried your baby for 9 months. You know what's right. You know what's wrong. Always follow your gut. They then tell me on the phone at the hospital that I had just called, well, we can't do anything for him if it's serious, so you would need to take him to the university, which is an hour from us. So I immediately get on the phone with my mom. I'm like, something is wrong with him. I just know something's wrong. I can't tell you what's wrong because I've never dealt with this before, but something's wrong, and I need you to get back over here. We hadn't even unpacked our bags yet. They were still in the car, thank God. So we get back in the car. We get to the university around 11:30 at night. And by the time we get there, our son is puking up bile, which looks like pond water. Literally just gobs of it. I mean, he is puking up bright green, mossy looking bile. We get in the doors. Thank God for, how fast that the hospital did work, because we got through those doors. They're immediately putting IVs in him. They immediately put a sump pump down his throat to start sucking up the air and getting the green stuff out, because they don't know why it's there, so they want to get it out for whatever reason. They're the number one. So the first things they start with is obviously X-ray, CT scan with dye, also ultrasound, which anybody knows that the X-ray they had noted, obviously substantial amounts of gas is what they're seeing. They can't see anything else because it's just gas blocking pretty much the whole image, just gas. So then they're like, let's do a CT scan with dye, which we had to continually check overnight. So they were in and out, I believe, every 2 hours checking that CT to see where the dye is ending up, moving in his colon at that point, or stomach, rather more, because we didn't know where it was stopping at. So they come back in at, I want to say it's like 8 o'clock in the morning, and they're like, hey, we did the last check for the dye, and it is stopped halfway through his stomach. We are worried about blockage at this point. Okay, so we are finally admitted. We had to wait for a room in the NICU due to how many days old he was. So they had to make sure that they had a spot for us before they could even fully admit us. So they get us in a room, and this is 9:30 in the morning when they finally get us admitted and in a room. So actually, as we're leaving the emergency room department, there's a team of surgical doctors following us to our room. And I kind of had a weird feeling that I'm like, this doesn't feel like just a run-in by chance. They follow us up the elevator. They gave us enough time to put our bags down, and they're like, your baby needs surgery, like immediately. We need to figure out why he is not getting the dye through his stomach and why there's a blockage. And it's not funny, but trauma does a weird thing to you. So there's certain parts of the story. I think his heart kept doing weird things too. Like his heart rate was elevated with this as well. Because I remember the heart monitors going off, but it was only when he was getting really, really upset, but that's when he had all the gas on his stomach. So that was another thing that we were watching at that point. So super stressful situation. So we get up to the room, they go down, and I think they talk to the radiologist to for sure confirm they're doing surgery. They said, we'll be back in an hour to tell you if we are or aren't, but we're almost positive we have to do this. We're like, okay. So again, it's all the paperwork. It's all the worry. I'm 2 days postpartum of C-section. We are completely overwhelmed because we don't know what's wrong with him. But so then we get They come back up. So this is around 10:30, 11 o'clock in the morning, and they're like, yes, we're going to do surgery now. We're going to take him down with us. The exploratory surgery will probably take around 2 hours, give or take. So, in the meantime, we're calling our family, we're telling them all the things that are happening. We really don't have answers. So then 2 hours goes by, and I'm just going to refer to him as Dr. G. Dr. G gives us a buzz on our little pager thing, letting us know they're coming back up to the room. So we go and we meet him in the room. He has a big smile on his face, and he said, we're just going to call it sticky poop. It looks like it's just sticky poop. There's a whole bunch of the meconium that bunched up, and it was stuck there. But he did pass bowel before we even took him to the surgery. So all great things. He just had a lot of backup, but no blockage. All great news. So we're thinking, yay, it's over. It's over. But it did not turn out that way. So they immediately let us start feeding him after surgery because he was hungry at that point. So we fed him, and not even probably 2 hours in, he starts throwing up the bile again. So, not good news. No more poop. Nothing else has happened in that aspect. So, we're now on December 19th, and they are saying, okay, well, now we need to start looking at different things here because this is not just sticky poop. But I do want to note in this, and this was a big aha moment for me, is what they don't tell you is after exploratory surgery, they are giving your baby opioids to make your baby comfortable. But if anybody knows anything about opioids, it also causes constipation. So the sad part about this is you're fighting constipation with a drug that also causes constipation. So immediately, and again, I didn't think of this until after the fact of the times that we had put him under and what that looked like. And I wish it would have stuck in my brain sooner. But that is the one thing that has forever stuck and ingrained in my brain, I guess I would say, is when they had allowed us to feed him right after giving him a constipation drug. So, again, this is December 19th, and they had given him, I want to say it was, I'm trying to think of what it was. I'll think of it. I'll think of it later. But it is an opioid, nonetheless. So, with that being said, moving on, it's the 19th, and they go, there's other things we need to look at this point based off of his symptoms and what's going on. First thing being cystic fibrosis, which is done in the paneling, which I had already done at the other hospital. So they were awaiting that paneling, but it was going into a weekend, so probably not likely that we would get the paneling back to know about that until probably a couple days. So we had to wait on that. I want to say it took about 4 to 5 days to get the results of that it was not cystic fibrosis. So then we moved into the other thing of which they wanted to push more cystic fibrosis testing. We told them no, based on everything that Holt had already been through. We were like, no, we're stopping there. We want to know about the other thing, which was the Hirschsprung's disease. So the first thing that comes in the step with the Hirschsprung's disease was the first thing of the biopsy. So the biopsy was the first thing that was performed to see about that, which was done bedside. They come in, we actually got to watch the whole thing take place, but bedside, obviously they go through the rectum. They say in the area that they test at the very end of the rectum, there is actually no feeling there. So he was actually happy when they were doing it because he was passing more poop so he was kind of happy that that was happening. There was no signs of it actually being painful. So I do believe what they say about that. There's no nerve endings right where they do the first biopsies. So we did that first biopsy. They had told us that with them having it in their lab, it would only take a couple days. Also not accurate. We had to wait, I think it was 2 weeks to get those results back. Again, I'm going to give them a little bit of benefit of the doubt simply because this was around Christmas. It was a weekend, a lot of things happening. So maybe those results come back at different places quicker, but in our circumstances, it did not. So that being said, so at the 19th, they decided they were not going to feed Holt anymore. We were not going to feed him. So what that looked like was pure chaos, not good, very painful for everybody involved, mainly him, but also his parents, because that was very painful for a baby to not be able to eat. Now, what I will say is they give them like a sugar drip, which I think is kind of like a trick on the mind, but also keeping their blood sugar where it needs to. So basically, they don't drop in their blood sugar, is what it was explained to me. It's a more dense, I'm not going to say it's like a thin sugar water. It had to be through an IV, which they eventually did move his IV, which that's the thing that sucks with babies. Their IVs almost 95% of the time blow out. So they end up having to put one of those ports like either in their head or some other place to keep it so it's a consistent spot that doesn't blow out. So they ended up doing that with Holt. He went 4 days without eating. And they, on the third day, decided that they were going to give him a sham feeding, which I don't know if that's something you guys are familiar with in the UK. They fill the stomach with food and suck it right back out to almost trick the baby. It truly is a sham. It's a trick. But the baby's like, you guys are idiots. I know the difference. You scream the whole time. So 10 out of 10 do not recommend a sham feeding if it's ever offered. Just very not good. So there was a lot of things that happened in the hospital, at our hospital particularly, that I was not super fond of. So Holt had a sump pump pretty much that whole time. So very hard to like hold a baby with the sump. Also, he's hooked up to IVs. But the worst part is almost sometimes the bedside manner, which I'm sure anybody can say that somewhere. But there are just some people out there that are not very thoughtful that this is a really trying time for a parent and it's really hard. And I think they're almost oblivious to it because they see it so much. I won't say they see Hirschsprung so much, but they see a lot of babies in the NICU and. But we were there. Surprisingly, there was not a lot of parents with their babies in the NICU when we were there, which to me was shocking. But I understand life happens. Not everybody can be there. But for us, there was no chance we were leaving. We were advocating. We were not leaving no matter what. One of us was going to be there at all times, if not a grandparent was there as well. So there was a lot of the teams would come in and they would meet every morning. So they would come in your room. This is a surgery team, pediatric team, as well as like I think a nutritionist would come in as well. So it's kind of like a meeting of the minds every morning, but they're coming in and they're discussing this in front of you about your baby. So this is December. So a lot of things happened in the hospital to where Holt would kind of revert back. But it was December 24th. The night of the 23rd, I had finally just had to come apart because he was on day 4 at that point of no eating. And I'm like, I told the charge nurse the night of, I was like, I don't care what time it is. When the surgery team gets here in the morning, I want them in my room immediately. Like, I don't care what time it is. 2:00 in the morning, come visit me, wake me up. I'm probably already up. So meantime, the good thing of him not eating is I got to store a lot of breast milk waiting for him to finally be able to eat. But the downfall was on the 24th, the morning of the 24th, the surgery team had came in and they're like kind of talking and it sounds like maybe they're going to let him eat, but not really clarifying that. And I'm like, here's the thing. My baby's eating today. I don't care what that looks like. If I have to sneak him food illegally, he's my child. I'm feeding him. Like, he's hungry. The cries he's crying are not pain cries. They're hungry cries. Like, I'm a mom of three, like four now, and I know he's hungry. We're feeding him. Like, that's it. He's had an empty stomach this whole time. He's passing, the wet diapers and all the things. So they're looking at me like, this woman's crazy. We're going to get her out of here. And they probably felt that way. And I felt that way as well. If that's what it takes, that's what it takes. So they come in, they finally pull the trigger and say, you know what? We're going to let him eat today. And I'm like, awesome. Love that. So I'm like, where are we at with our results? They're like, still nothing. Obviously, like I said, the CF was already ruled out. So it was the Hirschsprungs that we were waiting on. And again, this is Christmas Eve. And I'm like, here's the other thing. If this baby keeps everything down, we're leaving this hospital tomorrow. Because sitting here waiting on results does not do anything for anybody. I have other kids at home that need me just as much as he needs me. And I just need you to tell me where to from here to care for him at home. Because there's nothing you're doing here that I can't do at home. So they had told me basically if he kept all of his food down, which he did, and if he could keep like a substantial amount down, I think his goal was like 3 ounces, so many hours, which he surpassed with flying colors. No puking, nothing. So they say if he keeps everything down, we will do that. So next morning, he surpassed it, flying colors. So then they start teaching you how to basically, is it like, I forget the term of what they call it. It's basically you give him an enema up the rectum, you're cleaning him out. So I'm doing that. So they tell me to do that, or actually, I said that wrong. I had to give him suppositories daily. So 1 time a day, suppositories. If he did not poop on the suppositories, that is when they had told me that I would need to clean him out. The other option if the suppository did not work. But the suppositories did work. But that's a whole different feat, giving a brand new baby suppositories, because they do not make infant-sized suppository. I mean, you're talking toddler suppositories is what you're having to give your baby, which is very hard. So they released us on the 25th. I believe we got home around 2 or 3 o'clock. So we had been there from the 18th until the 25th. So that was our first stint of it in the NICU. So I think our follow-up visit was 2 weeks after we were released. And we go in, we still did not have results from the biopsy at this point. So we go into our appointment, we're talking, and I'm like, okay, did we get them? Like, that's what I assumed the follow-up was for. That's when they were going to give us the diagnosis of what they were seeing. And they come back and they go, it was a false read. We actually already sent it off to the Mayo Clinic as well, and it came back as inconclusive. So we're going to have to do the test again. So we do it right then and there. I'm already irritated, and I know things happen. They were having issues with the gun that they actually take the sample with. I could tell they were struggling. Again, I don't know what I'm watching for because this is new to me as well. This is all a learning curve at this point. So we do that sample, same exact procedure, bedside, happens right then and there. They're taking a sample of it. They're going to send it to their lab. 2 weeks goes by again. And so we're at a month now, and I'm having to give him suppositories every day. And that being said, so 2 weeks goes by again. I get a call, and they're like, there is none of the ganglion cells. We're not seeing any ganglion. Okay. Live ganglion, I should say. So, okay. And I'm like, what does that mean? They're like, that means that is another indicator that this is probably Hirschsprung's. So let's move on to the next steps and what that looks like. So the next step is they want to do a CT enema of a CT dye enema, basically, to where it lights up the whole colon to see what the colon looks like, because you're not going to see a perfect image without directly putting it in the rectum of that whole space there. So that's the next step. And then the other step is then going into and taking another rectal biopsy, except this one is more invasive. So they're trying to go as far up as they can without performing surgery, basically, in a nutshell, is what it sounds like to me. So we go in and we do the rectal CT dye first. That's the first step. We go in, we do that, and we see a picture of Holt's colon. And so a normal colon is all the same size. It's big, it's beautiful, it's perfect. It goes down to the rectum, it looks great. Holt's does not. So it looks perfect at a bird's eye view to start, but then it tapers off down. I want to say, I think they had said it was around 5 to 6 centimeters is when it starts thinning out down to the bottom of his rectum, is what we're seeing. So again, different doctor, she's saying, yes, this looks conclusive with Hirschsprung's, but I'm not going to tell you that. We're going to move on to the next step. So that's one day. So it was back-to-back procedures. We had did that day. We go back the next day to the university again, and then that is when they had done his procedure. And I want to say we came home the same day from the procedure of them putting him out. But it was like a 2 to 3 hour collection of sample, I think, around that area. And then that came back relatively much quicker than the other biopsy, because I think they were just looking at it under the microscope for the ganglion at that point, and kind of in a more hurry-wise, I think, at this point. So I think we got those results back within 4 days. So Dr. G calls me and he's like, hey, no ganglion again. So here's what we're looking at. He's like, we're probably going to have to do surgery. But what the goal is, which you can probably correct me on this because like I said, I'm kind of rusty on it. So there's the pull-through method, and there is the small segment versus the big segment. So Holt's was considered at the point of time from the CT, based off what we were seeing, was considered small segment. But again, we don't know that until we're in there doing surgery, because they're going to test the ganglion while they're doing the surgery and getting clarification. So, and again, I don't know how they do it there, but what the textbook term they do here is, so they take the segment that's bad, that's not testing with the ganglion, and then they add another, I want to say he said 10 centimeters or 10 millimeters above that. So Holt's was a total of 15 millimeters is what they had taken out. So I think it's 9 to 10 above the bad segment is what the textbook is telling them. And then they test again the ganglion around the donut. It's called a donut, is what they call it. So they test more spots around the donut where the reconnect takes place. So that comes back later. But as long as they are seeing the ganglion cells, that is where they're going to do the donut connection at, above that area there. So that's what they did. It was a total of 15 millimeters. And they take that, stretch it down, reconnect it to the anus area, which I think they leave a very small portion at the anus as well where they do the reconnect. So they do that whole surgery, I want to say, was around 6 hours. His actual surgery was 6 hours. So we come out of that, and the plan that they tell me at this point is Holt's goal is as soon as he poops, he can eat. That's what the saying is. So he poops, he can eat. But that's not necessarily true. So They tell you that because they don't want somebody to get upset based off of, but each kid is their own. Holt pooped on the second day after having surgery. Some kids can take up to 4 days after surgery to poop, but they will not give them food until usually that third or fourth day after the poop takes place. So again, they had allowed him to finally eat. Everything went really well. Um, Unfortunately for me, while I was in the hospital with him, I ended up getting influenza. So I had to call somebody in to stay with my son because I'm like, I'm sick. I need to go home, get away from him as much as I don't want to. I don't want him getting this on top of what he's already got going on. So Holt did phenomenal until I left the hospital that night and they stopped kind of checking his diapers as much as they needed to. And what they don't prepare you for is the extreme diaper rash that comes with Hirschsprungs due to the acidic poop. And the acidic, well, just the skin breakdown is unreal. It's almost like your baby. I never really knew the term of diaper rash until I dealt with Hirschsprungs because all the cases I dealt with before, that's nothing. That is nothing. That is a drop in the bucket. What I dealt with Hirschsprungs with my son is almost like a chemical burn to the skin. It if the poop sits on the skin for more than what feels like seconds, his skin is immediately breaking down. And that is extremely overwhelming. So I come home and I sleep that night and I come back to the hospital and they're calling me and they're like, hey, Holt's bottoms really broke down. We're going to get a burn team in here. And I'm like, a burn team? Like, what are you talking about? So I get back up to the hospital around 4 o'clock the next evening, and I am just blown away because I'm like, how did it get this way? Who let the ball drop? Why weren't you checking him? Like, we're here for Hirschsprungs. Like, this is a huge deal. Like, I don't know how to fix this at this point. Like, I'm frantic because I don't know what to do to make him comfortable because he's just eating and pooping more, and which is great. You never wish for more poop than what you do with Hirschsprungs. So it's like a double-edged sword. So I'm wanting him to poop, but then it's so bad that the acidic is so bad that I don't feel like I can control the diaper rash. So I think we were there for about 5 days, and then we were released. And that's with extreme diaper rash. Like, they came in, the burn team came in, blessed the ladies the night of, because the when I got there at 4 o'clock that night, the burn team had already left. They'd left like stoma powder is what I was left with. And they're like, use stoma, which stoma did help some. I will say it did help some. But I was just, they did this treatment on his butt that is almost like, this is just to tell you how acidic it is, but they did this treatment on his butt, and they almost say it's like a super glue kind of treatment. They put this ointment over his butt to shield his butt from the poop. It literally ate through the shield of the stuff they put on his butt. So it was almost pointless, and it got worse because then it started getting hung on his diapers. So if anything, learn from my decisions and all my things. Never do that treatment. I'll try to rethink of what it is, and I can always message you what it is. I forget what it's called, but it was a treatment that they had layered this on his butt. Again, it almost gives him like a plastic type residue over his butt to save his butt from the rash. But again, the acidic poop ate through it. So then it's sticking to his diaper, which is making it 10 times worse. So finally, on the 5th day, they're like, are you sure you want us to send you home with his butt looking like that? And I'm like, his butt got like this while we were here. There's nothing you can do here for me that I can't do at home. So lots of learning, lots of forums. what I had read was 100% cotton diapers. If you're going to use diapers, 100% cotton, which is very almost hard to find in store, almost impossible. So Amazon is the GOAT for the cotton diapers. So we got that on subscription rolling in 100%. They're called Pura diapers here in the US. So that's what we use here. That has worked for him. The other thing that if you're in a pinch, like Millie Moon diapers also here work in the US that I've seen that, give him a little bit of air, but like Pampers and stuff, no go. Huggies, no go. Not enough breathing stuff to keep it off of him. Also tried the cloth diapers. Wow, that's a lot of work. Kudos to the ladies that can do that all the time. I have tried and tried. And if we're ever in a pinch, I do still use them because they're awesome. If you did not have other kids to tend to, or, you can throw them in your laundry, they're super accessible and they're not like they used to be. So cloth diapers have come a long way. Um, but so we go through the surgery. I want to say the diaper rash was, it was a hard week, maybe 2 weeks of what felt like never ending results. Like you would think you would get ahead and then he'd have a massive blowout that he's out in for 2 seconds because, and here's the other thing that I want to say that I've noticed with Hirschsprung's, the smell. It has a very distinct smell. It's not like normal baby poop. It's very strong, yet it sounds very weird saying this, but like a sweet, bad baby poop smell. I don't know. I've never smelled anything like it in my life, but I know the minute my son poops or has gas because it's a very strong scent. And, I asked the doctor that and I'm like, is this a normal like thing for Hirschsprung's? And again, I don't think anybody really knows. He's like, it has a scent. And I'm like, oh, yeah, it has a very strong scent. Like, and he's like, that'll probably go away. It has not gone away. Um, so that being said, I want to say it was a hard 2 weeks, which takes an emotional toll on you as a parent because it's one, very overwhelming. Um, and two, it's just this new world that you never knew existed because I don't feel like Hirschsprung's is talked about enough, which you and I talked about at the beginning. Um, so it's very overwhelming, and you do feel very alone there for a very hot moment. But most of all, you just want your baby comfortable because he's already gone through so much that I'm just like, when does he get a break? Like, he's, his butt is raw, and out of all of this, babies are so resilient, and I think that you don't realize that until after the fact, and you're put in a situation like this, but they're so tough. And Holt is such a happy baby. Like, even pushing all that aside, like, he's just a happy go lucky baby that puts up with so much. So we are so over equivocally blessed in that aspect of he's such a good baby and has such a great disposition, subsiding all the other things that go with it. So my son's overall diagnosis was small segment Hirschsprung's disease is what he was finally diagnosed with. That is why we did the surgery that we did. But the overall the rash is your hardest beat when they're in diapers. I feel like it comes and it goes, and sometimes it's like, so Holt actually has some scarring already, like on his anus from certain spots of where the diaper rash got so bad that I would almost consider it a burn, honestly. But I don't feel like that's talked about in the hospital enough. They give you these little sample packets of like 40% zinc oxide, but what they don't take an account for is they give you this stuff, and they only gave me like 20 little things of these like sample packs. Your baby is probably pooping a lot in a day, and I'm going through those sample packs if not one or two a day. And then they don't give you more until you go back to the clinic. So, as a mom, you have to start doing your research because no one's going to do it for you. And so, there's always a way to figure things out. And that's the other thing I want to note in this is, as a mom, just give yourself some grace because you're doing the best you can with something you have no idea of how to maneuver, how to navigate. There is no perfect way to handle Hirschsprungs. There's not. You're going to have moments where you felt like you have gone 20 steps ahead to feel like you went 40 steps backwards. And there is nothing you're doing that's wrong. And there's nothing that you could do better than just love on your baby and do the best that you can and do research. There's forums out there that are all over Facebook of Hirschsprung's moms that I have seen and I love to follow. And I urge anybody that gets that diagnosis, plunge into that because you are going to get more literature there than you're going to get in any hospital room. That's just the truth, whether people want to admit that or not. But again, I think it's just because nobody truly knows what they're dealing with. So I urge any mom to just give yourself some grace, follow in those forums, just do the best you can with that. But there really is there really is some hard times that come with it, that it feels like it's never ending and you're not doing the best that you can, and you really do kind of ask yourself, you have pity parties. I'm not going to sit here and pretend like you don't and go, why did this happen to my kid? Kids, why my kid? He's such a good kid. Why did this happen? But I would, it teaches you a lot. It's very humbling. And that's the other thing. Like, I was just talking to my fiance the other day and I said, what do people do? Like, for our situation, we've had to go from a 2 income home to a 1 income home simply for the fact of the care that our son needs. And that I can't expect a daycare provider to drop everything they're doing to make sure that my son is doing all the things he needs to do. He's pooping properly, or the diaper rash is staying up. And, I'm like, where is this considered like a disability? Because it kind of is for a while until he can manage it on his own. It's not something I would put on someone else. We've been very blessed that we're in a rural community where we are, and we have great and our I'm going to say our daycare. Our daycare is a great in-home daycare, and she will take Holt in 1 day a week now that the diaper rash is under control, just to give me a little bit of a break, to kind of give me some time to just recoup and get caught back up on simple things. But I would never ask somebody to take my baby in with those kind of circumstances just because it's freaking hard. Like, it is. There's no rhyme or reason. Some days he has belly aches and some days he doesn't. And again, when you start entering the new things, like, we had to figure out the soy thing. So he's on alimentum. So that is a lactose free milk, and it works for us. And luckily, it hasn't caused him issues. But then you start adding cereal to the milk. Well, that could start adding more issues. Or, now he's on baby foods. So now I have to watch what I'm giving him because I believe it's all dietary that can cause bigger hiccups later on. So it seems like it's manageable, but you're still learning, lots of everyday instances of where to from here, and just monitoring and going, okay, well, bananas upset his stomach, so I'm not going to give him bananas, or green beans causes issues, or if you still want to implement that, gas drops have been a game changer for us. I've researched multiple different gas drops that we finally have found one which I'm going to show you at the end of the thing whenever. But I did save some things back to kind of show you that have worked for us and our family. And again, I know no two are the same, which we've talked about that too. But just any kind of information out there that's worked for us, I kind of want to help spread just because you don't know. When you go in, it is a total blind sighting situation. And My fiance and I were talking about that the other day as well. My goal is eventually to take like Hirschsprung's patients for mom, baby bags to the university just with products in them because I think it's just not talked about enough and it's very overwhelming. And you know what? There's so many good things out there that come out of this. One, the awareness, and two, just the appreciation that you have for your other healthy children, um, in a whole, and learning how to navigate something that can be very hard, but it is manageable. So that is a good thing. There are far worse things in the world, but it's just, I always say he's just extra special. My last one was extra special. And he went out with a bang and he needed all the attention, and here we are. So that's kind of Holt's story. We navigate through different days differently. Um, but that's kind of his story. I mean, it's just a day at a time. The other thing they say is they can't guarantee that he won't need surgery later in life. That's just one of those things. The other things that they talked about where we are as far as for him, so we're at 6 months visits now. I think we have one more 6 month visit, and then we go into yearlies with the specialty clinic. Um, and he said, if I would need to irrigate him often, there's the term. It's called irrigating them, to where you would need to clean them out. If you would need to irrigate him more often than not, that's when they would start talking about Botox injections, I guess, in the muscle of the anus to help him. Uh, but what was confusing to me in the diagnosis, and which again, this is kind of just for each their own, which was kind of weird to me, was what they talk about with a baby is they don't have the buildup muscle that a normal adult would to be able to push out poop like a normal person would. So to me, when it was explained, when they reconnected the good tissue to the anus, the whole thing was building up that muscle to the point to where Holt could manage going to the bathroom. So that's where I got confused with the Botox, because I'm like, well, if he doesn't strain a little bit, it doesn't build up the muscle properly. But then I think about, if you immediately start giving this child Botox, aren't you kind of training it to be lazy in a sense?
Yeah.
See, like, I'm one of those people, like, if it's not broke, don't fix it. So, like, for us, we've been very fortunate, and he's been pooping on his own. I'm not irrigating him or anything like that. But I do think that the gas drops make a huge difference, because, like, if he's, like, say he's fussy or he's whining, or if he gets himself to the point where he kind of sucks in the air, which is a downfall, because the more air they suck in, they get more gas in their belly, they're more upset. But it seems like if they do that, they pass poop a lot easier too. So it's like a double edged sword, it seems like, for me. Because that's when I noticed that he really has like a big blowout. Like if he gets upset, that's when he's going to have a blowout. But again, nothing abnormal and nothing like how his stomach was when we ended up in the hospital, to where it's ever been that hard. We've never had another scare like that again, thank God, to where it was just that hard. I mean, it was unreal. It felt like his stomach was going to explode, being completely honest. There was no more room to give for his belly. But that's kind of his story. I don't know what kind of questions you have for me, but that's his story as far as that goes. But it's a wild ride. I mean, it really is. Which you and I talked about, kind of at the beginning. It is just, I mean, and that's again what makes your podcast so interesting, because I even went back and watched other people's podcasts, and I'm like, that sounds nothing like my son. But then I'll watch someone else, and I'm like, that sounds kind of like what I went through, but not exactly. So no two are the same. That's a true statement with this, it seems like.
Exactly. Wow, thank you so much for sharing. Because I mean, one thing that I completely forgot to say at the beginning, and you mentioned it there, is you're only 6 months postpartum, and which I think, to then do that and then have the wherewithal to come on a podcast and talk so brilliantly as you have, kudos to you. Because I don't think there's many people in the world that 6 months after having a baby would go, I'm going to come, and all of the everything that's happened and the trauma associated with Hirschsprungs and everything you've had to learn to go, I'm going to go and do a podcast now. So I think you're absolutely amazing for doing that.
Well, I think what you do is amazing, and I think TikTok, that's where I had found your platform. I think it's such a huge deal to bring such a, with your platform, I think it's fantastic that you're bringing awareness because there's not enough. There isn't enough. It's not talked about enough. It's not, so when I started putting that tag in on my videos that I was going, and again, I took those down. I didn't take them down. They started to like, TikTok is such a beast of its own. Sometimes it works and sometimes it doesn't. So it like broke off all my videos and they were not in the right order. And I'm like, no, I'm just taking them off and I'll restart or I'll share his podcast after it's done and I can share his story that way. But I just wanted to bring awareness because I feel like there's not enough platform for it. And I did. I started reaching out to companies that I have found personally in the US that have worked for me and my son. And I'm like, I need you guys to understand there's a big niche for what you have here. And I think it's something that you should really offer to other parents. And I think it's something, that's why I wanted to make a goodie bag for moms because there really is no direction after you leave the hospital. It's here's this baby, navigate it the way we tell you, but your baby may not be navigated that way. And I think it's very upsetting as a mom because it's your job to nurture, first of all. And when you can't make your baby 100% perfect and you feel like you're not getting anywhere, that is so frustrating. And I'm sure any mom can attest to this. You are your own worst enemy. You're going to beat yourself up and you're like, how did I end up with this child and can I do this? That is a huge question that I had even at the beginning of our journey because I'm like, how do you do this? What is the right thing to do? And nobody can tell me because there's no one else I know that their kid has Hirschsprung. So when somebody's talking to me and they're telling me about well, this is what I used back in the 90s for diaper rash cream, it's not the same. Thank you, but it's not the same. So I am going to show you some products that did work for me. And again, I don't know if you guys have these over there or not, but these are things that did work for me and my son. So Aqua for Baby, and maybe we'll get sponsorship out of this, both me
Ooh.
and you.
Yeah, yeah, we'll split
Let's
it
try
50-50.
it. But no, Aquaphor Baby. So this is always what I start with for Holt. It just goes over the skin first. It kind of layers over the skin. I put it anywhere that I kind of remotely think that he'll go to the bathroom or have poop. Um, but then this is the holy grail. This right here will change your life. This is a 40% zinc oxide and it has a million and one different things. Like it just is the goat. I use the normal stuff on my other kiddos that's not the 40%, the triple paste. But it has changed. It has changed everything. They had it in a tub, and that's originally why I reached out to the company. So we go through these things. They're $20 a piece, each of them, weekly because there's just so much that you have to use it. I mean, I would pay $100 for it because it works. Please don't mark it up.
No,
But
no, no.
I would pay $100 for it because it has worked. It is tried and true. That is what we use on him. And then this is the other thing that I found. These are gas drops. I use it once a day in Holt's milk, and it has changed the game too. Um, but it's just a little bitty drop of it. You put it in his milk. You can mix it in with their food. Um, but those are all things that work for us. And I know that they won't work for everybody else. But the one thing I will say, going into our clinic, one, Dr. G is phenomenal. He's actually from Egypt originally, and he is a phenomenal doctor. He has listened to every concern I have. He has been amazing bedside manner. And actually, the funny thing that he's known for is all of his surgery bandages. He makes them the cover up he does on after surgery. They all have smiley faces on them. I've kept all of Holt's. he put smiley faces all over them on those bandages, and I've kept Holt's from all of his surgeries that he's had. But um, very cool. But the other thing that I think is remarkable, and I feel like every parent should have this kind of relationship with their doctor. Every diagnosis that I've gotten has physically come from Dr. G. He has been the one to call me. It's not a nurse calling me, it's Dr. G. He calls me, he tells me what he sees, he tells me where we go from there. And the other cool thing that happened, and I don't think this is talked about enough, which I have extreme gratitude for him because he's just completely changed our life. But the cool thing that he did do is I went in there and I had told him exactly what I told you about all those products that I'd been using. And he took pictures with his phone. And yeah, they can take pictures with their phone. That doesn't mean they're listening to you. Um, he took pictures with his phone, and I get a call from him about 7 o'clock a week later. And he goes, I want you to know that I had recommended your products to another Hirschsprung's mom, and it's working for the baby. And I just wanted to tell you thank you because people don't tell us stuff like this enough, and it does make a difference. And I think that that is the other thing I wanted to bring awareness to. Kind of one of those things, if you see something, say something. And if it works for you and it works for your baby, there is no shame telling people what that is. It feels like almost people gatekeep, which is such a weird thing. I'm like, there's babies out there struggling, man. Don't gatekeep. Like, just share it. Like, and that was the other thing. Like, if I could help one mom and another baby, I will share and share and share and share until I'm blue in the face because it is hard. It's really hard. And I was very blessed with three other kids that, never had that kind of need of attention. But again, like I had told you, that with all the testing and stuff here in the United States, they say it's 17% familial, which again is a weird number that you and I talked about that could be a very weird number to go off of. So, with that being said, and based off of Holt's diagnosis, they did not have us do genetic testing within our family. And that was a worry for me because I'm like, if my girls have it, can they have babies with Hirschsprung's disease? Or can Holt have a baby with another person? And or does the baby have Hirschsprung's? But again, you and I also talked about that is not a proven fact either. So it's kind of just one of those things. We are all doing research and all guinea pigs, I think, at this point, which is sad to say, but it sounds like that's kind of the case with this disease and very underdiagnosed, it sounds like. Lots of people probably in the world have it that have never been diagnosed with it.
Yeah. Yeah, exactly. I mean, it's the familial stuff. It is genetics is something that absolutely fascinates me because I just think it's why do people get Hirschsprungs? Nobody can ever answer that. You know why? And there obviously seems to be there is a family like the amount of people that I've spoken to who have Hirschsprungs then go on to have children with Hirschsprungs. But again, it's not all the time, and it's not specific to one type of Hirschsprungs either. So I just think that type of thing's fascinating.
It is. And it makes you think, like, is it a gene? Is it a mutate gene but again, it's a non-specific mutate gene if it is a gene, because like you said, it's not one way or the other. It doesn't mean that that child's also going to have a short segment or that it won't have large segment and that's the crazy thing to me is because it sounds like all the science that's behind it is moving in the right direction. But it just sounds like in each case is a little bit different. Like I've read that some of them have ostomy. Is it ostomy bags
Yeah.
till they're like 9 months? Because if that's the large segment, they can't fully do the reconnection because they're not big enough at the age they are as a newborn. So you're going to have to wait until they're bigger to perform that kind of surgery. So those were all things we went into it when we went into the surgery. There was a lot of unknown and no guarantee. It sounded like everything was when they went in and opened him up. That's when which I think all Holt's was laparoscopic. So they went through the belly button. There was like, I think a total of 5 spots. 5 spots, and then he has the larger incision from when they did the exploratory. But all very little incisions where they originally had went in and done the surgery itself for the reconnection. I guess the other thing that I would want to tell someone, because I was shocked, and I don't know why I was shocked, but after they do the surgery, I did not realize that you could see like the reconnection area of like the I guess the stitches.
Hmm.
Like you could see whole stitches, and that blew my mind because I'm like, how does a baby not get an infection when they're pooping on an incision site, but they don't? He didn't, and it never got like weird or anything, but that did blow my mind. When I was changing his diaper, I'm like, oh my god, are those stitches? But again, they had showed how I guess they have to stretch that area so it kind of is lax right after surgery. So that's the other thing I would urge another parent: do not be surprised. It is there. Don't be shocked. Don't think something's wrong. There's not. But those are just all things that kind of stick in my brain. But I think that the biggest thing to note is always trust your gut. Always know as a parent, you have to advocate for your child. I understand that there probably are some not good healthcare people out there, but there also are some really good healthcare people out there that genuinely care. And I hope that anybody that goes through this experience is at least one of those people, because it's a very trying time. It's very hard, and people that don't understand it, I wouldn't ever wish that on them. But I also know how hard it is to explain to someone a disease that you don't even understand yourself,
Yeah.
because people have questions. Well, what is this, and why is it like this? And you just look at them and you're like, I can't tell you why. I can't. Don't mind that fly. I can't tell you. He wanted to be in your podcast too. But it's just like, yeah, it's hard. It is hard. But there are really good people out there, and I hope that as things get more advanced in the technology area, maybe more answers will come about, for people that have so many questions, because there are a lot of unknowns. And I think that's what's scary about it, because I actually do know a person, not to go too far off topic, but there is another person in the area that I'm in, not too far from me, and she has, I believe, 4 children, and 2 out of the 4 ended up with Hirschsprungs. And what was crazy is her other children, which I don't want to speak too much on it just because they're not my children, but they also had another kind of disease that had paired up with the Hirschsprungs. So,
Yes.
and it was the same disease that had paired up on both of her children with Hirschsprungs. So that is the other thing that I'm finding, that sometimes maybe the diagnosis isn't just Hirschsprung's. There's something that underlays with it, which is kind of crazy.
Yeah. Yeah. No,
So,
absolutely. It does have lots of other associated things with it,
yeah,
most definitely. But no, thank you so, so much for sharing, because this has been, yeah, fascinating episode. And just finally, I know you touched a little bit on Holt's future and checkups and appointments, etc. But what do you kind of hope for him in the near future?
gosh, I just hope for him in the near future. I just want it to keep going smooth.
Yeah.
I do. I want that normalcy, but I will tell you, there are fears as a mom going into this, that the unknown probably eats you alive more than not, and you probably wouldn't say it out loud, as a caretaker. But the world is mean, and the thing that worries me most for Holt is what school future looks like, with the gas, or with the agitations with things, or my hope for my son is that he just brings a kindness to the world that we don't see often anymore, and a resilience that, people look at him and go, wow, Holt's such a nice person, and look at what he's been through, and he holds his head high, and yes, he's different, and but you know what? He's here. He's doing things. He's working hard towards things, and he's, you know, advocating for people that are going through this too. And I just hope that Holt brings awareness to people where it's at. And I also hope that other people also educate their children that people are different and that, you know, kids aren't mean to him, because that is a fear for me as a mom moving forward. Because in a world of not nice kids, there's also not nice adults that don't educate enough. And I hope and pray that people that have never gone through this can look at people that have gone through this and understand as a parent that we just need to teach our kids to be kind. And that's something that I teach all of my kids. And my kids all have each other's back. They know that there's nothing stronger in this world that you can depend on other than your siblings, because those are the people you're left with when your parents are gone. And it's so important. And I want to bring awareness to the world of what we went through, and it is not a cookie cutter ideal thing. Um, but I want happy for my kid. I want him to bring awareness, be happy, and I want him to live a life that he's proud of, and um, just have the education and spread it to other people, because that's where it's at, and that's how we all learn and work together, learning about more things. And um, but honestly, it's word of mouth that's educating anybody on this diagnosis at this point. So that's what I hope. I hope that the world is just kind, and I hope that my kid contributes to that.
Absolutely. No, incredibly well said. But Ken, thank you so, so much for coming on. This has
Absolutely.
been fascinating to listen to, and I wish you, Holt, and the rest of your family all the very, very best for the future. Thank you so much for coming on.
Thank you so much for having me. I appreciate you and you spreading the awareness as well.